Hi everyone, it's Dr. Olivia Lesslar for CFS Health. Today's presentation is on making the diagnosis of ME/CFS from a doctor's perspective. Now, I know that some of you are struggling to get a diagnosis, but I wanted to give you the doctor's perspective as to why this may be a little bit difficult. So as you know, the diagnosis is a diagnosis of exclusion. And so there are a lot of different hoops that one has to jump through. It is definitely best that from the get-go, you find the right doctor for you, someone who is empathetic and can take the time. It is always a red flag for a chronic sufferer like yourself to have a doctor who doesn't seem quite interested in you, because that is reflective of his practice or her practice longer term. And you need more than that. Now, the reason why I recommend that you find someone appropriate from the get-go is because this diagnosis, being a diagnosis of exclusion, requires you to be with this doctor from start to finish, making sure that you exclude all other issues, that they know you, and that you spend the appropriate amount of time with them. If you jump from doctor to doctor, that looks like doctor shopping, which is a bit of a red flag as it is. Second, any new doctor taking on your case is going to have to start from scratch anyway, because their name is going to be pinned to your diagnosis. And depending on the country that you're in, this will make a difference with regards to insurance, work cover, issues with employment. And so that's why the doctor may want to redo everything. And the other thing is, because you have to make sure it's not a lot of other diseases, this takes time. So please be patient with your doctor. Let's get into it. So it doesn't look like much, the overall simplified diagnosis algorithm. A patient presents with profound fatigue, which has substantial decrease in function. This has persisted for more than 6 months. There's post-exertional malaise and unrefreshing sleep, and also cognitive impairment and or orthostatic intolerance. And then you get your diagnosis of ME/CFS. But it isn't actually that simple. We know that there are some minimum blood tests in Australia that we have to do, and that is as per the RACGP. I'm sure that it is actually not that different from the countries that you are in. We do a urinalysis, which, as the name implies, is an analysis of your urine. This will give us an idea of how well your kidneys are working, because we can see how much protein there is in the urine, for example, if there's hints of an infection with a urinary tract infection. Full blood count, this is the red blood cells and the white blood cells. Again, it can tell us, if there's signs of infection, how well your bone marrow is working, how much your bone marrow is working. Liver function, thyroid function, which I know a lot of you have had issues with. Erythrocyte sedimentation rate and CRP, or C-reactive protein, are 2 markers of inflammation, acute and chronic. Random blood glucose, because fatigue and infections can be due to diabetes or prediabetes. Serum creatinine, screening blood tests for gluten sensitivity, and also celiac disease, because if you are not appropriately absorbing your nutrients, then you're going to be vitamin or nutrient deficient, possibly, which may lead to fatigue. Serum calcium, creatine kinase, and iron studies. Now, when you do these minimum blood tests, a lot of the time it won't give us much. If you do have issues with any of your blood tests, thyroid, especially iron studies, then it's something that at least there's a hole that you can plug, see how you go, and then move forward. This is why it is so difficult for a doctor to pin their name to a diagnosis of chronic fatigue. And this is because this slide is the differential diagnosis of chronic fatigue, which goes through all the different organ systems: endocrine, which is your hormones; neurologic, which is your brain; rheumatologic, which is going to be your joints; and psychiatric; hematologic or oncologic, which is going to be blood or cancer; and then others. So as you can see, this is why it takes so long, because your doctor of symptomatology, what you are telling them of objective signs and symptoms of your blood tests, then have to exclude all of these different diseases before they're able to then definitively say that you have ME/CFS. So why are there so many different symptoms that you may or may not have? First of all, we know that there are going to be predisposing factors to ME/CFS. Genetics obviously play some role, and as I have said previously, it just means that your guns are loaded. You still have to fire them, and the firing of them is your triggers. Acute or chronic infection, which is a huge one for many of you, especially EBV, environmental toxins, and then many of you type A personalities, and chronic stress, and then a huge emotional or work trauma. It basically sets off your CFS because this affects your immune system somehow. From that, you get muscle symptoms, which is going to be your post-exertional malaise, for example. You're going to have immune system issues, so sore throat and sensitivities to new foods and chemicals. You're going to be affecting your brain and your spinal cord and your autonomic nervous system. And this is going to be leading to sleep issues and headaches, hot cold intolerance, orthostatic issues. So, that's why there's a concurrence of POTS with many of you. And so your doctor has to take into account the fact that you have all these many varied symptoms. He has to, or she has to, exclude all other illnesses that would cause those issues, knowing as well that the reason why there are so many different symptoms in the one person in different organ systems is because, one, it may be something obscure like ME/CFS. Two, and this is for a very tiny number of people, it could be malingering, or someone trying to make out as if there is an issue, and they're saying that there are problems in the different organ systems, which sometimes don't make sense. And three, you've got these varied symptoms which could be caused by another illness. Now, these illnesses that the doctor is trying to exclude don't themselves have a linear trajectory either. It is not as simple as, right, okay, you have issues with brain fog and fatigue, and you've got immune issues, and your skin's not healing that well, and you may not have any gut issues. And I have seen this before in a patient who wound up having celiac disease. So your doctor has his or her work cut out for them because it's so multifactorial. And unfortunately, in this day and age, with public health care and whatever, you don't really get that kind of time that you need with your doctor either. And as well, with the time limit placed on CFS diagnoses, which is, it has to be at least 6 months, and it couldn't have been a lifelong thing. It has to have been like an acute onset. Your doctor also needs the time to spend with you to figure out what's going on, what's acute, what's chronic, what's new, what's not. Because as you can imagine, if you have ME/CFS, and then in the middle of it, you can be just like every other person and also get food poisoning, for example. Your doctor, she has to figure out that that was literally just food poisoning and not celiac disease or some other issue with your gut, like a mast cell degranulation or something like that. Falling back then, so I've shown you guys how tough it can be, but even though it is difficult and it is a diagnosis of exclusion, there are certain criteria. And the criteria goes all the way back to the Holmes criteria in 1988 to the most recent IOM criteria of 2015. They have different names: CFS, ME, SEID. The onset has to be new. You cannot have had these issues since birth or since very, very young. Then there are the functional impairments, and how do you quantify that? The minimum duration is generally 6 months, except for the international consensus criteria of 2011. But if you go down this list, you're looking at symptom requirements for each diagnostic criteria, and you will find that more than likely you will meet diagnostic criteria for 1, maybe 2, but you won't meet diagnostic criteria for all 5 of these. Generally speaking, we no longer do homes, but we still talk about Fukuda. And in fact, the NCNED, which I have talked about previously, the National Center for New and Emerging Diseases at Griffith University, actually, when they put out their surveys to patients, they will actually try to use at least 2 or 3 of these diagnostic criteria to try and get in as many different patients as possible, because we are still learning about this illness. We are still trying to figure out what are the criteria that will exclude and include. So if you go through this criteria, persistent fatigue, cognitive issues, motor sensory disturbances, memory issues, pain, sleep disturbances, etc., 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 you will find that you will actually meet criteria for one of these consensus. Now, knowing that, give your doctor time. Of course, relay to him how you feel about what you think is going on. But remember, and please be patient and understand that your doctor, they went to medical school, and it is their responsibility to not leave any stone unturned. And therefore, it may take more than 6, 8, 12 months. Because if they rushed the diagnosis and didn't pick something else that was treatable and left you with a diagnosis of ME/CFS, that's on them. Later on down the track, 5, 10 years later, when you find out somehow that it was something that you could have treated slightly more easily, you're going to be mad at them, and they know that. And they are pinning their professional credibility on the fact that they have to exclude all these different diagnoses, which are not linear in presentation. And there's always atypical presentations for those other things as well. And they have to make sure it's not that, as well as make sure that you meet the criteria for ME/CFS, because this is not exclusive criteria. In other words, you can have another illness where you would meet the criteria for ME/CFS based on these 5 different consensus criteria, but it's not CFS. So your doctor has to exclude that as well as include you in one of these criteria. Now, if you get to a point where it has been a very long time and your doctor, and you feel like your doctor is unwilling to make a diagnosis of ME/CFS, you just have to speak to her. You have to ask why, because there is there is an algorithm to this, right? You have to exclude other things, do minimum blood tests, you have to meet criteria. What else is left? And if she or he is thinking about a different road that they would like to go down, and that's very plausible, just ask them about it, because they may not be sharing that information with you because that's not how they practice, or they don't think you'll understand, or it may be a potentially scary diagnosis. Whatever it is, just be really open and ask. All right, guys, I hope that this was handy. Please let me know if you have any questions and leave comments. Okay, bye. I hope you found that useful. If you are looking for practical help with your recovery journey, check out the CFS Health online recovery program at www.cfshealth.com. We're helping people in over 50 countries improve their health and regain quality of life.